My name is Gabriel Gary Brandeis. I am the Senior Medical Director of the New Jewish Home in New York City. I have been a medical director for over 20 years, mostly in Boston with Boston University, and now at the New Jewish Home, affiliated with the Mount Sinai School of Medicine in New York City. The first difference is it is very specific about a topic. It is meant to answer questions that arise while caring for a patient. For example, if you have a pressure ulcer or pressure injury, that both of those terms are in the guide, that you see and you want to know, what should I do? What do I need to put into it? So the pocket guide can give you some great direct answers. It does not go into a lot of details as far as the research and the science behind it, but it's a quick reference to answer the question that is facing the practitioner while the patient is there. All nursing home residents that receive federal funding must undergo periodic evaluations through the minimum data set, or the MDS. It's now MDS 3.0. And the documentation needed for pressure ulcers is, according to the MDS documentation, which is under the old terminology of pressure ulcers. Several years ago, about 2 years ago, the National Pressure Ulcer Advisory Panel amended the definitions. They added some new definitions, they increased the definitions, and they changed the terminology from pressure ulcer to pressure injury. While these recommendations are still controversial, they are out in the literature. They are endorsed by the major American organization that deals with pressure ulcers. So we've decided to include both in the pocket guide. For the practitioner seeing the patient today in the nursing home or in the post-acute and long-term care setting, the documentation that is coded by the homes still is the MDS documentation under the pressure ulcer category, as opposed to the pressure injury category. There's overlap with many of those between the ulcers and the injury, but the difference is the injury also adds new categories that the ulcer definitions do not.